Selamat pagi, selamat bergabung bersama kami dalam acara Digital Healthcare Skills for the Future. Acara ini merupakan kolaborasi antara IA-CEPA, ECP Catalyst, dan Asosiasi Telemedicine Indonesia atau ATENSI. Nama saya Clarice Campbell dan saya akan memandu acara di pagi hari ini. Good morning. Thank you for joining us in Digital Healthcare Skills for the Future. This event is a collaboration between the IA-CEPA, ECP Catalyst, and the Indonesian Telemedicine Association, or ATENSI. My name is Clarice Campbell, Lead Advisor for Skills at Catalyst, and I will be your host today. This dialogue will be presented in both English and Indonesian. So at the bottom of the screen, you should be able to see an interpretation button. If you require this service, please click on the button and select your preferred language. As this is a webinar, viewers won't be able to turn on their camera or microphone. So if you have a question for a panelist, there is a Q&A box which you can type your question into. Please identify yourself when asking a question by writing down your name and affiliation and make it clear who the question is directed to. Please note this event is also being live streamed on YouTube through our channel at IA-CEPA ECP Catalyst. Today we have a great lineup of speakers representing the medtech space in Indonesia and Australia. We have Bapak Professor Purnawan Juwandi, Chairman of ATENSI, Bapak Dr. Niko Azari Hidayat, Lecturer at Airlangga University, member of ATENSI's advisory board and founder of Vascular Indonesia. Bapak Hendra Cheong, CEO of Click Doctor, Ibu Kamini Pillay, Education Manager at the School of Nursing, and Ibu Melissa Ciarduli, Faculty Simulation Lead, both from Heimsland Institute in Melbourne. We also have Ibu Amy Zhang, who is the General Manager of the Asian Growth Markets at Cochlear, and Bapak Han Zhao Zhang, who is the Education and Research Counsellor at the Australian Embassy in Jakarta. So without further ado, let's get into the session. The COVID-19 pandemic has affected healthcare systems like never before. Many in lower and middle income countries have had to adapt to healthcare platforms, Indonesia being no exception. The Indonesian Telemedicine Association has been at the forefront of this exciting transformation, and we're happy to have with us Professor Purnawan Juwandi, Chairman of ATENSI, to provide opening remarks. Professor Purnawan Juwandi holds multiple senior leadership roles in the medical industry. He's actively involved in the Indonesian Medical Association, the Indonesian Nutrition Association, and the Indonesian Nutrition Institute. He holds a PhD in Urban Technological and Environmental Planning and a Master's in Public Health from the University of Michigan in Ann Arbor, as well as a medical degree from the University of Indonesia. Most recently, he served as an evaluation team leader in a special task force on stunting at the Office of the Vice President of the Republic of Indonesia. Professor, good to have you with us.
Thank you. Thank you, Clarice Campbell. Good morning, everybody. Selamat pagi, teman-teman semua. Hadirin yang hadir pada kesempatan ini, mohon maaf video mungkin saya matikan untuk menghemat bandwidth ya. Oke. Jadi sorry ya, nanti saya akan buka. Baik. Sebagai ketua ATENSI, pertama saya mengucapkan terima kasih ya, kepada IA-CEPA ATENSI, IA-CEPA Catalyst yang telah bekerja sama dengan kami sehingga webinar ini bisa dilaksanakan. Mudah-mudahan kita nanti berlangsung lancar sampai selesai nanti. Saya juga barangkali untuk pertama kali mengucapkan selamat kepada kita semua yang bisa hadir karena kita tetap terhindar dari pandemi COVID, baik Dari mulai bentuk yang awal sampai ke yang akhir ini Omikron Beta 2 ya. Mudah-mudahan kita akan tetap terhindar. Salah satunya juga karena webinar ini memungkinkan kita melakukan kerjasama kegiatan secara lebih aman. Pandemi ini memang memberikan kita dua muka ya. Jadi kita lihat memang Indonesia juga terkena dampak dan barangkali juga seluruh dunia sehingga banyak perusahaan juga bergulung tikar ya. Banyak pegawai menjadi tidak bisa bekerja. Tapi di sisi lain membuka wawasan baru, membuka kesempatan baru, membuka juga tata jawab baru. Dan pandemi ini adalah blessing in disguise juga buat telemedicine. Karena telemedicine mau tidak mau akan menjadi salah satu tulang punggung kesehatan dalam 2 tahun ini. Ya. Karena dia merupakan mode komunikasi pelayanan kesehatan yang jauh lebih aman baik untuk pasien maupun untuk provider. Jadi memang ini adalah saat yang tepat bagaimana kita bisa berkembang lebih pesat ke depan. Saya terima kasih kepada para panelis ya, yang akan berbicara pada kali ini. Karena memang kita ke depan memerlukan sebenarnya tidak hanya skill, ya, tapi seluruh sistem. Karena komunikasi kita akan berbeda, etika kita berbicara akan berbeda, teknologi yang ada di belakang layar juga akan berbeda. Dan ini semua memang perlu kita kuasai ya untuk ke depan supaya kita bisa lebih memanfaatkan teknologi ini untuk kepentingan pasien, untuk kepentingan juga kesehatan seluruh bangsa Indonesia. Ya. Jadi terima kasih, selamat mendengarkan dari para panelis. Thank you all. Go back to you, Clarice.
Thank you, Professor Purnawan. Now, before we get into our panel discussion, it wouldn't be a webinar, let alone an Indonesian webinar, without a mandatory photo of our speakers. So I'd kindly like to ask all of the speakers to turn on their cameras, and we're going to take 2 photos. So if we could do that now. Okay. All right. Sondang, I think you're taking the photo. So if everyone could smile, 1, 2, 3. And maybe one more. 1, 2, 3. All right. Thank you, everyone. Okay. So as we've just heard from Professor Purnawan, COVID-19 has changed the way consumers, including Indonesian consumers, think about healthcare. Increasingly, digital healthcare platforms are being seen as able and capable of delivering and enhancing the safety of healthcare. But in this sprint towards smarter healthcare, just how engaged are medical professionals in Indonesia in understanding the utilization of healthcare technology? And what does it mean to create a digital-first health experience in the Indonesian context? So now we'd like to hear from Dr. Nico Azari Hidayat. Dr. Nico is a lecturer at Airlangga University in Surabaya. He's a cardiothoracic and vascular surgeon at Airlangga University Hospital and the founder of a health startup called Vascular Indonesia. Dr. Nico, thanks for joining us.
Yes, thank you, Clarice, for the introduction. Assalamualaikum warahmatullahi wabarakatuh. My best regards to all the panelists, all the staff that are holding this event. Allow me to share my duty today because I have to share about diagnosing Indonesia's health challenges for the future digital healthcare. So yes, as a doctor, we should know about inspection, palpations, percussions, auscultations as one of the examinations packages to diagnose. So that's why if I mention diagnosing, I should think about that. So within my at least 7 slides only, I will describe about these things to do. Yes, next. Yeah, as a doctor, cardiothoracic and vascular surgery as my clinical major field, I need to assure the highest performance to inspection or observations on health challenges that truly correlated with other speakers, of course, about skills demands, current reality, and also for the digital healthcare future. Next. And back to speak about diagnosing Indonesia health challenges, thanks to colleagues, our colleagues Firman Fitular and Ariel Utomo that mentioned in 2021, Indonesia claimed to be one of the global epicenters for COVID-19, perhaps because of the huge population of 270 million of people. But the fact that 5% investment for health, but it is planned to increase 9.5%, that seemed to be dramatically low for a big essential country like Indonesia. Some other challenges are the chronic problems in health system, gaps in health infrastructure, the availability and quality of health workers, inequities in access to healthcare. Also, the government tried to solve by digital health transformation. Maybe some of you might hear about a digital health transformation office, and each aspect to improve in healthcare system. Also mentioned as well, persistent gender disparity is also being the challenge in Indonesia. Not to mention stunting among children, anemia among women. It refers to investment, of course, for food security, high cost of treatments and economic loss to NCD, non-communicable diseases in Indonesia, like diabetes and cardiovascular, still having the burden in Indonesia. One aspect of regulation, it refers to something that Atensi also deals, is regulation about the telemedicine. So we need to do something about this. We need collaboration about this to create the policies and health system. Also, COVID-19 pandemic impact is not over yet. So human resource for health distribution still remains a problem. So also high dependency imported vaccines, drugs, and medical devices. Next. So when I need to do palpation, it means that I have to feel the problems. I have to touch the problem. So I try to create schema: health, problem, technology, care and services, also market. We all know 70% in Indonesia, men above 20 are smokers. It is quite a problem that maybe in the future will develop stroke, cancer, diabetes, heart diseases. Also, diarrhea, clean water still remains a problem that mentioned in some literatures in journal articles. Malaria, gastroenteritis, typhoid, paratyphoid fever, dengue. And we are also facing now technology, health products, medical devices, pharmaceuticals, and about the care and service, the ratio of doctors treating people in Indonesia, 3 doctors to 10,000 people. It's crazy. I mean, only 60% insurance, yeah, and also problem of distribution and market expenditure by 60.6 billion in 2018 US dollar, right? And the low growth for 6 years, 14.9%. So yeah, we are facing the challenges in Indonesia, yes. And slide, please. Yeah, doctors, nurses, and hospitals are the subject to deal with the challenges. So on my auscultation, my observation, we should all feel their voices, their notes. How can they balance their quantity to quality? How perform professionally in such massive workloads? Doctor, nurses, and hospital facing the industrial era, not to forget, that perhaps they were not in their college books. Moreover, when entering the entrepreneur world, for a medical person, it would not be that simple, since giving in altruism principle is a strong insight in every of them. Even sometimes, again, professionalism issue, right? Slide. That's why I try to express these at least two strategy. I mean, with ATNC, we should collaborate on telemedicine. We should remember telemedicine is not only teleconsultation, it's also referred to telehealth, telesurgery, teleradiology, telelaboratory, and also telenursing. And one of the creative tele is one of the telehealth tourism that I also built, Medical Tourism Indonesia, medictourism.id. Is a platform of in Android, so that people in Indonesia could find the best treatment in Indonesia. Slide. And the last thing is the message to aim to partnership. We should build the telemedicine and medical tourism by collaborating with IA-CEPA, ECP, with ATNC, as a comprehensive and collaboration, also cooperation. We can do HR workshop and training development, research, B2B, B2G, B2C. Thank you. I'm Niko Azari Hidayat, ATNC Indonesia.
Thank you so much for that, Dr. Niko. I think it's important to note what's happening in Indonesia through this shift to virtual care. And of course, it's not unique to this country, but what makes it special is the process towards integrating physical and virtual ecosystems, which are differing sort of from one market to another. So our next speaker is the CEO of Indonesia's leading digital healthcare platform, Klik Dokter, a company that was founded on a simple yet revolutionary idea that everyone in Indonesia should have access to the best healthcare. Pak Hendra Chong has held multiple successful roles in private equity and venture capital across Asia prior to joining Klik Dokter. He's a graduate of the Haas School of Business at the University of California in Berkeley. So good morning, Pak Hendra.
Morning. Thank you for inviting me to join this talks. Hopefully everyone is healthy here and take care. I mean, if it's possible, work from home. Yeah. I think we can go to the slide directly. Next. Okay, before maybe I talk about healthcare technology. We should understand first what are the key challenges in the current healthcare system in Indonesia. There are a few points here, 3 points here. Number one here, actually, one of the key challenge in Indonesia is Indonesia actually offers the lowest rate of hospital beds in Southeast Asia. It offers about 310,000 hospital beds, so about 1.17 beds for 1,000 population. It is the lowest amongst ASEAN countries, and it is among the lowest in the world. And the country needs about 15 times its current number of doctors to reach the level of OECD countries. The second point here is we all know that Indonesia has a lot of islands, 17,000 islands. So this causes a complex geographical structure in the healthcare services. And the third point here is imbalance in health workforce in Indonesia. Basically, according to the data from Indonesian Doctor Association, it shows that 2/3 of Indonesian doctors are based in Java, with almost 30% of total operating in Jakarta. And many of the countries' medical facilities are understaffed. So it has 4 doctors per 10,000 population, according to the World Bank data in 2018. Hopefully this number already increased until now. Okay, we can go to the next slide. The two other key challenges in the current healthcare system is number one is low private health insurance penetration despite fast growing economy. As you see on the right chart, the red one actually is the BPJS, the public health insurance. Indonesia right now is about 78%, lower than the other ASEAN countries. And the blue one here is the private health insurance, which is the lowest as well, less than 5%. The second point that is the key challenge in the current healthcare system is the rising cost of healthcare for the government. So the nominal health spending has been steadily increasing in the last 8 years, but it remains the lower of Southeast Asia in terms of the percentage of the GDP. Okay, we can go to the next slide. So this is what I want to summarize here. As you see on the middle graph here or the chart here, most of the doctors are based in Java, and most of the doctors are based in Jakarta. That actually caused a lot of inefficiency for people, let's say from Kalimantan, Sulawesi, Sumatra, to receive quality healthcare services. So 4 doctors serve 10,000 people is very low in Southeast Asia. That's why telemedicine is very important in Indonesia. I think with the telemedicine, people actually can receive good quality standard from the doctor in Java or mostly in Jakarta. I think we can go to the next slide. Despite all the challenges, right, Indonesia is favorable to digital health tech. We are 185 plus million active internet users from a total population of 273 million. More than 64% of Indonesian population are active internet users. So we expect the demand for health tech is expected to increase in the coming years, as also the government begins to promote health tech services. As we all know that the government actually openly has discussion to offer a BPJS service of the public insurance to telemedicine in the coming future. Yeah. So right now there are 17 telemedicine in Indonesia who offer telemedicine via the Peduli Lindungi application. Yeah. So it's a good sign for Indonesian health tech industry actually. I think we can go to the next slide. I think there are the main point that I want to show here is how the e-health tech has been incorporated in across healthcare supply chain. I think most of the people in Jakarta, especially in Jakarta, right, they have been using telemedicine application to do, let's say, booking for COVID test, antigen, and you see here below here is a e-prescription as well. There's also a clinical decision support system, appointment scheduling, and there are also media that people can read to understand more about specific medicines or diseases. So it's very important for this telemedicine company to grow as well. I think we can go to the next slide. So this slide here actually shows the digitalization of healthcare services from beginning of our life until let's say we pass away. Yeah. So as we know in Indonesia itself, there are a lot of health tech companies that already offer gynecology services, basically for pregnancy women, such as Hello Bumil or the other application. and as time goes on, let's say for baby growth as well and development, and children health. So these are some of the services that they offer. Yeah, and as it goes by, let's say as we grow all, people actually also can receive a consultation for, let's say, for diabetes, hypertension, and for other chronic diseases. So I think this slide, I just want to say that health tech is not only telemedicine. Yeah. There are a lot of services that will be offered in the future. I think telemedicine is a basic thing in health tech sector. But there are much more that are coming up. I think from our competitors as well, they are also offering new services in the coming future as well. I think we can go to the next slide. So telemedicine is a unique industry in all over the world. Yeah, not every country can be successful in telemedicine. US is doing very well in telemedicine because of the clear regulation from the government. Indonesia is growing, and hopefully it will be a successful story. But we know that most other countries are not doing well in telemedicine because maybe it is a small country. Let's say for a country like Japan or Korea, people can go see doctor within 10 minutes travel. But for Indonesia, it's unique because we have a lot of islands, and most of the doctors are based in Java. So, but we also need support from the government because in here it says the key to successful telemedicine is when there's a clear regulation from the government. One main point is when there's a clear regulation on purchasing prescription drugs from the government, then telemedicine can prosper. That's what I think. I think there's also some talk as well from our competitors. I think they also have the same opinions. I think we can go to the next slide. So since 2019 until now, there are a lot of telemedicine regulation by Indonesian government, basically to support telemedicine in Indonesia and also to support purchasing prescription drugs through online consultation with doctors. So basically, if you don't consult with doctors, you cannot buy prescription drugs. That's what it is on point 4 here. Okay, we can go to the next slide. So we all think that telemedicine is becoming part of the normal due to COVID as well, because people try to avoid hospital. So as you see on the right chart here, the medical services is doctor consultation, treatment of minor ailment, buying medicine, hospital booking, and counseling services. I think as the time goes by, you'll be used more for other services as well. I think that's all from me. I think if you guys have any question later, then we can do a Q&A.
Thank you so much for that, Pak Hendra. Picking up on the experience of Click Doctor, as we've just heard, research has suggested that increased adoption of telemedicine by consumers is likely to remain above pre-pandemic levels as we adopt, the new normal. And, other health technologies will continue to grow over the coming years. From a skills perspective, that's a large niche to fill to be able to thrive in this post-pandemic future and own skills that match the ongoing structural shift. I'd like to invite our next speakers from Holmes-Glen Institute in Melbourne. Kamini Pillay is the Education Manager of the School of Nursing, and Melissa Chiarduli is the Faculty Simulation Lead. Welcome, Kamini and Melissa.
Thank you, Clarice. So welcome from Melbourne, Australia, and our presentation today on digital healthcare for the future. And thank you for inviting us to this event. Next slide. I would like to acknowledge the Wurundjeri people, who are the traditional custodians of this land. I would also like to pay respect to the elders, both past and present, of the Kulin Nation and extend that respect to other Indigenous Australians present today. Next slide. My name is Kamini Pillay, and I'm the Education Manager in the Diploma of Nursing program at the Holmes-Glen Institute. And my colleague presenting today is Melissa Chiarduli, who's our Simulation Program Leader at Holmes-Glen. Holmes-Glen is a leading Australian provider of vocational and higher education with over 35 years of experience and more than 130 graduates. Next slide. So digital health is the application of information and communications technology to provide digital health interventions to prevent disease and improve the quality of life. These include mobile health applications, electronic health records, telehealth and telemedicine, and wearable devices. Other examples you may be familiar with are fitness trackers, smartwatches, wellness applications, and so forth. Next slide. So the National Digital Health Strategy sets out 7 strategic priorities intended to support Australia's vision for digital health. And you can have a read of this, this later. Next slide. So health equity is all about making healthcare more accessible and affordable for everyone. And digital health trends are the driving force behind health equity. Next slide. So as listed on the slide, you can see that digital health has many advantages, all of which are leading to expanded healthcare access and continuity of care, which is most important. Next slide. There are some hindrances as well, and I think a few of them to mention are they will require heavy training and a steep learning curve for adoption into clinical practice, patient access to devices to sustain digital health, and cybersecurity issues as well, which are never ending. Next slide. So looking here at what are the benefits for both the healthcare worker and the patient. So the technology should enhance the user experience to reduce the likelihood of error. So greater use of digital will reshape the recruitment, the training, and retention landscape for healthcare staff, both clinical and non-clinical. And as far as patients are concerned, the role that patients will play when it comes to proactive health management through digital health could be significant. When patients have access regularly to their own health information, the hope is that patients will be empowered to take care of themselves, as they'll understand well-being and be more engaged in self-care decisions. For example, if someone with hypertension could link their diet, their weight, and their increases in blood pressure by seeing their own data, they will better understand the cause and effect of their behaviors to their health. And this is what we mean when we talk about patient empowerment. Next slide. So what you see on this slide is actually an e-script token. So electronic prescriptions are providing Australians from 2020 a convenient access to their medicines and improves patient safety by reducing the transcription errors. So a person can access this in person via their doctor or through a telehealth consultation sent straight to their mobile phone or to their email. Next slide. This is an image of Australia's My Health record. My Health Record is a secure online summary of an individual's health information, which, with the patient's permission, healthcare providers can view and add patient information. So health professionals can access timely information about their patients, their health summaries, prescriptions, pathology, immunization records, and imaging reports. So My Health Record is now serving more than 23 million Australians and their healthcare providers. Next slide. So we're just going to show you a video shortly. So to show you how technology is playing a greater role in the efficiency of the new Bendigo Hospital. The Bendigo Hospital is one of the most technologically advanced hospitals in Australia, featuring a number of innovations that ensure patients enjoy a more streamlined, comfortable experience and that clinicians can deliver world-class care. We'll go to the video now.
From a regional and rural context, we're no doubt the smartest in the technology that's been built in the last 5 years. That gives peace of mind to our community that we've got the foundation, we've got the right architectures to move forward for the next 20 odd years. So we provide a range of up to, I think, 16 different telehealth sorts of activities, specialist consult care between hospitals via video conferencing. So that's where you've got a specialist in Bendigo providing specialist advice to remote rural regional hospital. So it's about expanding the walls of the hospital through digital and technology and providing those services in a very safe and secure manner too. We have a number of new technologies that are new to health and therefore new to the way that healthcare services can be transformed. And we do some cool things like online real-time ordering of food and providing a safe menu ordering system for patients so as they can order an appropriate meal that matches their allergies and alerts. Smartest or coolest technology would have to be our automated guided vehicles, and they're robots that carry linen. They're quite sophisticated, they're driven by wireless technology, they have their own pathways, their own elevators and lifts that eventually they find their way through the hospital and pick up the goods and deliver them back. I think if you're looking at it from a technology viewpoint, you really don't see it, but the integration of all the systems that just happen to be there and work 24/7. So we're connected to 96 different interfaces now. It's all real time and it's running smoothly and all synchronised. Part of the mobility and one of the core principles was to have wireless technology. So we've got splash out, got 100% inside, in wells, in lifts, car park, on the roof. And we have a splash out of around about a 20-metre perimeter outside of the hospital. And then as you walk from building to building within the same precinct, it'll roam, so it'll keep you connected. That's almost a must these days in hospital design, where most clinicians want to work by the bedside, so working with a fixed computer is no longer the requirement. It's got to be mobile, it's got to be a tablet, it's got to be some other smart device. What a digital hospital means for patients is that there's a lot more productivity and efficiency in the way that we use and manage our data, which ends up in a more safer environment for patients. So no longer does a patient have their history in 5 different databases. It'll be in one database. The data will be shared, so you can get access to that data by the bedside. A clinician can get access on a laptop. You can get access via internet and secure services when you're home. And in fact, you get access anywhere where there's a secure internet site. So you're really taking now, from a patient perspective, the ability to monitor real time bedside devices, connected into electronic medical record, recording all your observations electronically, and a clinician can read that from wherever they are, either inside the hospital or external. Safety principles, quality care improves, as well as efficiency and productivity of our clinicians.
Next slide, please. Okay, so we know that the COVID-19 pandemic has kicked open the door with force to digital healthcare. And the most impactful COVID-19 technologies include patient-facing tools, such as online symptom checkers, patient portals, remote patient monitoring tools, and telehealth. I'm going to hand you over to Melissa. And Melissa is going to discuss how the current COVID-19 pandemic and subsequent lockdowns and pivoted to online learning forced our faculty to think outside the box and to deliver our nursing students digital healthcare simulations in a virtual environment world. Melissa?
Thank you so much, Carly. That's great. You just keep this slide on. Thank you. As discussed, we adjusted to digital healthcare, and it was essential that our future nurses also felt prepared and knowledgeable and ready to enter this new digital healthcare world. Homeschooling has been achieving this goal through simulation-based education, which is repetitive practice of non-technical and technical skills in a safe learning environment and without real risk to patients. We feel very blessed at Homeschooling to have an amazing simulation centre. The photo that you see now is showcasing one of our simulation apartments designed to replicate the real-world healthcare environments. In this case, students are participating in a hospital discharge meeting scenario while their colleagues observe their actions in a theaterette with one-way viewing glass, then later all coming together for a facilitated group debrief. Next slide, please. The next few slides showcase our Diploma of Nursing students working with our simulation resources in the nursing laboratories. This one, the student is working with a part task trainer and she's learning how to draw blood. Next slide. Our 3G Sim Man is always popular with the students. Here students are learning how to give CPR. Next slide. Our neonatal 3G simulator cries and moves and breathes and is also very exciting to work with. Next slide. Our simulator participants are professional actors who are skilled in immersive simulation and part of our homeschooling workforce. They work through a scripted scenario in character for the required role, creating a challenging educational experience for our students. Next. Currently, we have around 50 simulator participants from diverse backgrounds, including LGBTIQ actors and children. Next. During the COVID-19 pandemic, our nursing program involved the acquisition of technical and clinical skills needed to be adjusted to prepare our students for the digital healthcare world they'll be now entering into. So high fidelity simulations involving virtual reality and online immersive simulation were successfully introduced into the remote learning platform, which I'll now touch on. Next. Our simulator participants quickly became one of our greatest assets as we tried bringing them into the WebEx spaces. So we thank Susma, who is our nursing student, and Sheila, our SP, for giving permission to use this image. Working closely with the faculty, the high fidelity simulation through the lens of the computer was born. Students had the opportunity to interact with patients. Sometimes there was up to 6 SPs in different WebEx rooms, which the students would enter, admit, discharge, educate, etc. Although it was quite overwhelming at times, the students quickly became very confident at adapting to our telehealth environment and the art of communicating when not face-to-face. Next. A newly developed virtual reality program was another amazing opportunity for students to experience a digital health platform. This program involves the use of virtual reality headsets with students immersed in a 360-degree pre-recorded simulated working environment. Our VR program exposes students to complex situations they're likely to face in their professional work in the future, with SPs undertaking the roles of patients and families in crisis situations. Next. The program was designed to enable 100% of students to actively participate in a digital simulation learning experience anywhere, anytime, any place, scenarios including dealing with an aggressive client, a person with delirium, a deteriorating patient, and a patient receiving palliative care. And this is just a bit of a whole lot of photos regarding that program. Next slide. So this slide depicts a planning process for the immersive scenarios and reflects what you see as you work through the scenario with your VR headsets. So I like to simplistically compare it to a choose your own adventure activity, branching scenarios, providing options of what to do. Based upon the choice, the consequence is played out, and in this case, the deteriorating patient. Next. I'm not quite sure if you can play this little snippet. This is just shows a medical professional who's an actual emergency physician entering a scenario after the student decided assistance was needed. We'll move on. So we're very proud of our virtual reality program and the online immersive scenarios. So research and student feedback has reflected that both programs have positive outcomes on problem solving, communication skills and clinical safety. Students reported an increased feeling of confidence going on to clinical placement, even though we were unable to offer our normal face-to-face laboratory classes. Our next project is going to be focusing on the implementation of electronic medical records in our nursing laboratory classes to reflect the expansion of digital health and EMR rollout in most major public hospitals in Australia. The incorporation of a VR scenario complemented by portable tablets can be an exciting project and undoubtedly be another step towards a future of digital health at homes, Glenn. Next. We thank you for your time today. If you'd like to know more about the Australian digital health initiatives, we provided further links to resources. Next. We hope you found this session rewarding and informative, and welcome anyone listening today to feel free to contact us via our socials or email addresses provided in this slide. And lastly, next. Thank you again. It's been a privilege and an honour to speak today. On behalf of Carmody and myself, I wish to thank Farah Shamara and the team at Catalyst for this opportunity to network and collaborate within and across organisations worldwide. We hope you enjoy the rest of today. Please stay safe and take care.
Thank you so much for that, Kamini and Melissa. It was really fascinating to see the sorts of skills that you're teaching students in really testing circumstances, and also to think about how those technologies could be applied to the education system in Indonesia and, you know, the opportunities for collaboration between Australia and Indonesia in this space. So at Catalyst, we work to connect businesses in Indonesia and Australia with the hope that the benefits offered by the Indonesia-Australia Comprehensive Economic Partnership Agreement, or the IA-CEPA, will be maximised. For more than a year now, Catalyst has been working towards improved market access, increased two-way trade and investment, and inclusive economic growth in Indonesia. In light of that goal, we thought it would help to provide a more regional, if not global, look at our topic today with digital healthcare skills, to find out what the Australian experience is like in tapping into increasing potentials of medtech. Let's hear now from Amy Zheng, who is the General Manager of Asian Growth Markets for Cochlear. Cochlear is a Sydney-based global leader in implantable hearing solutions. The company has a global workforce of more than 4,000 people who share a collective determination to give more people the opportunity to enjoy a life of hearing. Good to have you with us, Amy.
Thank you very much, Clarence. Good morning, everyone who are on the call, and very nice to meet everyone here. And thank you very much for Catalyst for inviting Cochlear and inviting me to speak at this occasion. This is a topic that is very close to many of our hearts, because our business is being disrupted significantly by COVID-19. I will say that telehealth, telemedicine has become one of the main drivers for us to not sustaining the business and continuing with the business, but actually finding new growth opportunities for our business. So next slide, please. So let me just give you a little bit of background about who we are, what we do for Cochlear. So Cochlear is a global leader in cochlear implantable hearing devices. So today I'm very pleased to see that this conference is even supported by sign languages, you know, for audiences who have a hearing impairment. And that is a community that needs a lot of help globally. So you know, we know that globally this is a very diagnosed, undertreated condition, especially in the emerging market. So Cochlear in the past 40 years that we have been on the forefront to really providing a technology to restore those patients' hearing and with this implantable medical device. So in the past 40 years, we have implanted more than 600,000 devices globally, and that is about 180 countries in the world. So Cochlear has 6 manufacturing sites globally. Our headquarters is in Sydney, Australia. We are a global company that with more than one. We are a global company. We have about 1.4 billion of revenue as our total turnover. We have more than 4,000 employees globally. And as this company, we are very proud that we are dedicated into investing back into research and development. We have invested more than $2 billion into research and always want to bring in the best technology and also suit the lifestyle changes for the patient that we care for. Next slide, thank you. So this is our global footprint. We are headquartered in Sydney. We have a manufacturing site in Sydney, Melbourne, Sydney, Brisbane, KL, Malaysia. We are also having an R&D center and also manufacturing site in Sweden and in US. So that is where we have gone into. So a young company, but very established in this space. Next slide, please. These are our implantable devices. I will tell you a little bit more about how cochlear implant works. It's a pretty specialized field, but you will find that the technology is truly amazing. So what you see on the chart is that on top, these black devices, these are the sound processors that receiving the sound from the environment. While at the bottom of the slide, you see this round shape titanium devices. These are our implantable devices, surgically implanted under the skin, and this are mounted on the scalp and inserted into the cochlear that converting sound signal into electrical pulses and then sending it to the hearing nerves and into the brain. All our technology right now can be monitored and managed through the apps that developed. So our apps allow the patient to, through Bluetooth technology, to link to their mobile devices. So when they watch videos on the YouTube, when they listen to music through Spotify, that sound can be automatically transmitted into their brain. Next slide, thank you. So this is a diagram to show you how Cochlear works. So first, that it has this inner part, which is the this inner part that implant that converting the sound signals into electrical pulses and training the brain and to converting that into hearing sound, so the brain can pick up that the sound again. And the external component is the sound processor that's receiving the sound from the environment, from conversation, and enable our patient to hear again. And the whole process is basically bypass the inner ear, which is also called as a cochlear, as most of the patients have already had malfunctioned inner ear. So we have been in Indonesia for almost 15 years. And throughout the 15 years, we have gotten around 1,000 recipients in this country. And so for cochlear implant, this is still a very specialized field. And in Indonesia, that all the hospitals and clinics who are independent, who can independently implant cochlear implant through these delicate surgeries are mostly located in Java Island. As Hendra earlier, talk about that this is a country is geographically very challenged for providing care to patients for access. So we have a similar challenge, at many other medical fields, that facilities are established facilities are available, they are up and running, but they are very, very concentrated in the big cities and in Java Island. However, our patients are everywhere. Every 1,000 newborns, there are 4 babies that are born deaf, and this patient can be anywhere in Indonesia. When they receive the implant, they have to travel, to the Java Island and to go through the ENT surgeries by us cochlear implant surgeons. And after they have finished the surgery, they need to stay in the hospital for 14 days till the wound is healed, and then switch on the sound processor. That's the start of the new hearing journey. And the hearing journey actually, wouldn't, end here, because these patients have never heard any sound before. There is a process called habitation or rehabilitation for patients who have never heard sound, or for patients who have heard sound before but have stopped hearing for many, many years. The brain has already forgotten what the sound is like and how to listen to sound, then how to speak again. So there is a series of occupational therapies, or we call it speech and language therapies, that their job is specialized to train the patient to listen to the sound coming out from cochlear implant devices, and train the brain to listen again, and train their brain and train them to speak again. And this process actually can take up to 6 to 12 months until the children are able to catch up with their hearing peers and go into the mainstream schools and the mainstream societies. And usually our habitation services are done all through the face-to-face therapies. The parents will need to take their time off, bring the children to the clinics and to our service centers. And that is the most, so far, the traditional way, but the most effective way. And as you can imagine, for young babies, when they are implanted, they are younger than 3 years old. So finding the right time for the babies, for the children to calm down, to receive the therapy is actually a pretty challenging job, for the therapist. So when the pandemic occurred 2 years ago, and we have a big challenge, because the awareness for parents to go for cochlear implant for their children is pretty high. They know that they need to take action early. Every month of delay of implanting their children with the hearing device, that means that their children will have less chance to develop the brain fully as their hearing peers. So the parents are really in a race to go for the cochlear implant for their children. However, after the surgery is done, that they have to go back to their own cities, go back to the island where they are located. That because of COVID, they are no longer be able to travel due to the travel restrictions and social distancing. So all these hearing and speech language therapists will have to go do online for video conferences. That actually create a lot of challenges. First, connectivity is an issue when the internet is not very stable. Second, the therapist may not be fully trained to conduct these teletherapies on the speech and language training. And thirdly, in that 1 hour session, the parents and the children are not in a very relaxed mode. So that actually affects the quality and outcome of such therapies. So we actually see that in order for patient continue to benefit this device and make sure the hearing performance and the outcome of the surgery is optimized, and we need to do something differently. We need to think out of the box. So we actually collaborated with a application developer, and the group that behind this app is called the Sporkle. The Sporkle app is actually developed with a group of audio-verbal therapists certified by the A.G. Bell Academy from the US. They are highly trained, specialized therapists that know how to work with children and parents. And they have this beautiful app that developed as a home-based sessions, and training the parents to follow bite-sized videos and teach them day by day, week by week, month by month, what they need to do with the children, how to play with the children, how to speak with the children, how to sing with the children. And there's also an interface that is by the login of the professional. The professional can actually monitor the process of this home-based therapist. So then there's a channel now that the therapist through this monthly, their usual monthly telemedicine, consultation with the parents. They will first review the SPORCO record. What have you done with the kid in the past 4 weeks? What has gone well? What hasn't gone well? And then the parents actually will give feedback, of their experience. So the whole session will become much more effective. And then the therapist will actually give further input and guidance to parents what to do in the next milestone in order to reach the next milestone. So Cochlear see this as an opportunity that we collaborated with SPORCO, and we provide this app to many of recipients in Indonesia who actually face this challenge of not having access to the therapies during the pandemic. If you move to the next slide. I'm not sure whether are you able to play this video? Okay, I don't think is that not possible. Okay, if that is not possible, I will skip the video. Basically, the video shows the interface, how SPORCO app works with the video guided step-by-step approach to guide the parents, and how the SPORCO app also connect parents with the therapist. So what is the feedback from the SPORCO users? And the first is from a parent. The parent actually feel that very confident teaching my child, as the activities are very easy to follow. Another parent says that the small doses of the therapies actually make it much easier to incorporate in my child's everyday life. And for an experienced speech therapist, they feel that the app is very great to support his and her therapy and make it less challenging actually with the digital connectivity issue they always face when they have the video calls. Next slide. Okay, thank you very much. I think this is the last slide of my session. I think what I want to share here is a very small experiment, but I think if this proven to be useful, I think this can actually shape up the category and how we actually provide patient care to a traditional medical category and further benefit more patients. So the business model and also the care model actually can evolve through the support, through the availability of a digital health in Indonesia. Thank you very much.
Thank you so much for that, Amy. It's really interesting to see a successful Australian health tech company expanding globally and offering solutions that are not necessarily readily available here in Southeast Asia, and helping so many people with this advanced technology. So it's really amazing to see. So that concludes our panel session. So thank you to all of our presenters. I think you've all shared some really interesting and useful insights into the future trends of healthcare and the skills demands involved in this shift. So we're going to now transition to our Q&A session. So if you have a question that you have wanted to ask to one of our panelists, I encourage you now to put your question into the Q&A box. Please include your name and affiliation and direct your question to one of our speakers. So one of the first questions that I want to ask is directed to Dr. Nico. It's from Professor Pronawan, one of our opening speaker. And he says, pertanyaannya yang sering keluar dari pasien, apakah data saya aman kalau menggunakan telemedicine? So he's asking if patient data is safe if they're using telemedicine applications and services. Over to you, Dr. Nico.
Yeah, well, actually, compared to patient or people itself, themselves asking about their data, well, many more patient or people will share their data automatically if we are realized, isn't it? So their data like ID or maybe their habit, platform of telemedicine should have a protection to keep the data. It is the demand by the government, by the Ministry of Health, also by the regulation. As long as the platform, protect or keep the data, and not to share it, it will be safe. So that's why in Atensi, we are covering the almost 30 or 40 now, the telemedicine platform that we daily drill them not to obey, not to disobey. Disobey the privacy of patients' data. Thank you, Clarice.
Thank you so much, Dr. Nico. The next question I have is from Rianto Tanzil to Pahendra Chong. So he said, during the presentation, we see that the ratio between doctor and patient is almost at 1 to 100,000, if he's not mistaken. So his question is, by having this technology, would it not decrease the ratio? And would it be busier for doctors to handle all upcoming consultations from this telemedicine services? And how can we manage these conditions?
I know the number of the doctor and patient would not change, but then doctor can serve more patients. As we know that maybe the doctor who just graduated from university, they will need more time, right, to have more patients. So this opportunity will give them access to more patients, not only in the area but also throughout Indonesia. I think in the coming future as well, right? Advanced technology can help answer questions that are regularly asked by patients, let's say by bots or by things like that. I think. Sooner or later, this will happen.
Great, thank you so much for that. So our next question is from Nabila Nisa, and she's directed this to Holmesglen, so to Kamini and Melissa. And she's asked, what's a good program to take if you want to pursue work in the medtech industry?
Okay, so we have posted something in the chat box as well to Nabila. You are welcome to contact Holmesglen at holmesglen.edu.au and refer to our community and health courses. I think you could be looking at something like the Cert 4 in lab techniques, which might fit your need. And we do also welcome international students.
Great, thank you so much for that. I'm sure that there are plenty of different courses available depending on your passion and interest and the specific area that you want to get involved with. So you can certainly hit up some of the education providers from Australia for further information about that. Our next question is going back to Dr. Nico. So Farah Shamara has asked, seperti apa perjalanannya startup bidang kesehatan seperti vascular Indonesia? Bagaimana resep dan rahasia untuk berkembang? I think you might be on mute.
Could you come again?
Yep, we can hear you now.
Could you come again? Sorry.
Oh, the question is, seperti apa perjalanannya startup bidang kesehatan seperti vascular?
Okay, I get it. Thank you. Yeah. Well, I've answered actually. One keyword is actually disruptive and agile. Now, non-stop learning, non-stop improving what we are now. Actually, I'm started actually from I'm a government employee in the University Hospital Airlangga, but I started from zero. I built Vascular Indonesia, Varices Indonesia. Varices is for varicose veins. Aviation is arteriovenation for hemodialysis patient get communicate, because every patient characteristic with a different background. Also, I have kaki diabetes Indonesia. Kaki diabetes is diabetic foot, telehealth as well. So the key is actually never stop improving, never stop learning to achieve the best goal. And we should collaborate. Not to forget, we should collaborate and put some nice things in it. Like example, in kaki diabetes, I put artificial intelligence to determine the classification automatically by artificial intelligence. I collect thousands of pictures of diabetic food so that it easily and automatically, this is a Wagner 5 diabetic food. You may go to blah, blah, blah. So I think the creativity and then the enthusiasm to never stop learning is the keyword. Thank you, Clarice.
Great, thank you so much. And I think this could be directed to Dr. Nico or to Pahendra. We have a question from Sean Wood of Curtin University in Perth. What are some of the shared challenges with the provision of expanding digital health access in Indonesia that would benefit from collaborative research between Australia and Indonesia?
I think the challenge is both these countries have different regulations. I think there should be some agreement at the end to, let's say, if we want to do some collaboration in the future.
Clarice, if I may share, instead of all only challenges, Mr. Dean, Sean Welburn would, I should share also opportunities. One keyword is medical tourism. We have our project of integrated health tourism project in university based. Perhaps we can collaborate with Curtin University, Perth, Australia, because in regionally based, it should be better rather than Indonesia itself and then Malaysia or Australia itself. We can collaborate together to learn what is advanced treatment, to learn what is the nursing advanced treatment, to learn about the advance of technology, robotics, perhaps, and everything, and etc. I mean, we could collaborate on a specific term of health tourism, Mr. Dean. Thank you.
Yes, that's a really good suggestion there, Park. Kind of finding a focus area to, find a research topic that benefits both countries. And I think sticking with you again, Dr. Nico, we have a question from Steve Aditya. He says, how is the telenursing being accommodated in the current nursing school curriculum? And how can we benefit from adopting international standards?
Well, yeah, telenursing is one of the challenging things to improve. Once a time, I supported some of the nurses in Indonesia from Universitas Indonesia, Brawijaya, Airlangga itself, and then Hasanuddin Makassar. I pushed them to create something, telenursing platform to help patients recover from COVID. We call it Sanubari. Sanubari is from Indonesia. Hasanuddin, Ba is Brawijaya. Ri is Airlangga. Sanubari means in Indonesia is soul. Sanubari is soul in Indonesia. So we try to encourage the nurse, especially the mental health nurse, to help people recovery from COVID-19. So by entering that idea, I think we could go a standard. I mean, we should try a single thing first, like I always do, and then we talk about the standard, how to implement in telenursing in the education base? Thank you, Clarice.
Clarice, boleh saya tambahkan? Can I add some more?
Boleh, boleh.
Ya, jadi okay, one of our member is perawatku. Perawatku means my nurse. So it's already a platform for nursing services, offering nursing services. And we have now also some professor from the Faculty of Nursing, University of Indonesia, also show interest to help to develop a platform for nursing services. So I think we are developing also services, nursing services in here. That's why I thank you for that, Melissa and Camille examples. I mean, that's the way we will go also.
Great, thank you so much, Professor Pranawan. The next question I am going to ask is from Grandiano Escal Terrigan, and I'm going to direct this actually to Amy Zhang from Cochlear. He says, how successful is the world community in knowing and receiving the benefits of digital healthcare, particularly when viewed from the perspective of people who are unable to access digital health care due to economic factors? Amy, you mentioned that there were quite a number of people in sort of remote areas in Indonesia who had accessed your services. How is your company sort of reaching out to those people who do live in those more remote areas? And, you know, do you have any advice for other healthcare services who are looking to do the same and ways to do that?
Thank you for the question. I think that's a topic that we can discuss and debate for hours. It's actually remaining one of the highest biggest challenge for our business is really providing the market access. The access is in multiple folds. You know, access is about affordability and getting government or getting any form of a subsidy or reimbursement for people who are able to pay. And also access is about accessing to facilities, accessing to care, accessing to service, you know, for example, for cochlear implant recipients. Once they are implanted, they remain as a customers of Cochlear for the rest of their lives until, you know, if the implant, you know, break down but nobody wants to do another surgery and change the implant. So we need to look after this patient for many, many years or even decades. So we need to actually really work in a long term, you know, strategically. There are a lot of levels of engagement that we are working on. Today, what I have shared is within a smaller scope that what Cochlear can do in providing innovative solutions and to crunch the needs, you know, for the current moment. However, if we want to scale up the patient access to a bigger level, we really need to work with the government, with the Ministry of Health. And I'm very glad that this is today that on the forum there are many my counterparts on this forum are already at the forefront of trying and piloting many of the new ways of doing things, like the Click Doctor. I think it's an amazing platform, and how to integrate a service provided by private sector, but integrating it with the mainstream government supported healthcare system is going to be the next game changer. I think only that, you know, can actually provide a long-term solution for the patient who are in need. And in the midterm, I think there are also a lot of other organizations like the NGOs, like philanthropy bodies that who are, you know, considering compelling cases, you know, to provide that case. That we have worked with several of them, and to really sponsor those patients who actually have the need but who are not able to pay. So I think it's going to be a journey. It's going to be a mission, you know, for all of us to work together, especially in emerging market like Indonesia.
Great, thank you so much for that. We actually have a attendee who has raised their hand, so I'm going to call on Dr. Hartat Ningsi to unmute yourself. and you may ask your question. If you can. Okay, I think it might be a bit difficult to unmute at this stage. So the next question is from Rudy Purba, who's based in Canberra, and he's directed his question to Dr. Nico. And his question is more so about the policy side of things. He says it's been shown that, that there are low levels of national healthcare worker ratios, such as the number of hospitals, beds, and compared to the Indonesian population. And unless these ratios are improved, there is a tendency that digital healthcare capabilities will grow rapidly in the immediate future, but potentially unsustainably and only in the high-level tech side or niche or elite markets in Indonesia. What are the best sort of national strategies to avoid these conditions?
Yeah, well, Mr. Rudy Purba, yeah. Well, this is the tough question, but I always, and also the Professor Purnawan in Atensi, will try to stay focused on optimism, optimist to stay with government to build this digital transformation succeed. So our Ministry of Health now have the strategy plan with the Digital Transformation Office to build even fast, even a larger area to digital health can communicate between patient, doctor to patient, also the patient to nurse, and also the hospitals. And of course, in the community of doctors, also try to improve themselves. So overcome the problem of the ratio, I think it should be collaboration continue. So yeah, Clarice.
Clarice, bisa jawab juga?
Silakan Pak.
Oke, itu kan pertanyaan juga sebagian ditujukan ke saya ya. Jadi saya mau ngomong juga dari policy kebijakan gitu. Mungkin kita harus juga lihat macro side dari pengembangan kesehatan di Indonesia. Jadi setiap tahun itu kita meluluskan sekitar 12.000 dokter baru. Ya, jadi is large number. Malah kita kesulitan bagaimana untuk mencarikan tempat kerja untuk mereka ya. Itu kenapa kita mengembangkan telemedicine, karena telemedicine is substitute also untuk sebagai tempat kerja. Sekarang kita sedang mengubah undang-undang regulation dari undang-undang pendidikan kedokteran, jadi medical education law ya, yang memungkinkan hospital base. Jadi nanti pendidikan spesialis akan jauh lebih mudah dibanding sekarang, karena sekarang kan university base. Nanti akan berpindah ke hospital base. Kita juga akan memberikan insentif untuk dari daerah-daerah untuk belajar menjadi dokter, karena akan ada insentif untuk wilayah-wilayah tertinggal untuk sekolah ke universitas yang baik atas biaya pemerintah. Jadi itu saya kira akan banyak menolong. Nah, telemedicine sendiri juga sedang mengalami perubahan, transition. I think hopefully we will have regulation for telemedicine also. You know, now we are in the, we call it regulatory sandbox. Hopefully in the next month, we will go to the regulatory sandbox to see what is fit for the telemedicine in the role of the health services in Indonesia. By next month, we hope we will have also electronic medical EMR, electronic medical record, which is already in Australia, but we are not yet. But almost all the start platforms are using the electronic medical record. So we just maybe tinggal mencocokkan nanti apakah kita sudah sesuai dengan standar pemerintah tentang electronic medical record. Saya kira perkembangan akan banyak terjadi dalam 1 tahun ini, karena dalam tahun kemarin kita sudah berkembang 600% ya dari pengembangan telemedicine dibanding sebelum pandemi. Saya kira itu. Terima kasih.
Terima kasih Pak Pranawan for your comments. So I'd like to conclude our Q&A session. Thank you for everyone who has submitted a question into the chat box, and thank you for staying with us. Now I'd like to actually thank the Australian Embassy for their continued support in promoting opportunities for closer and more meaningful Indonesian and Australian partnerships. And with that, I'd like to call on Han Xiao Zhang, who is the Education and Research Counsellor at the Australian Embassy in Jakarta. He was previously based in Canberra, where he served as the Director of Economics and Research for Higher Education at the Australian Government Department of Education, Skills and Employment. So thank you, Han. Over to you to give some closing remarks.
Terima kasih, Clarice, and selamat pagi, everyone. Look, thank you for giving me the opportunity to say a few words at this important forum today. I know these remarks will not do justice to the quality of the content that's been provided by our panel of speakers today. And I would like to acknowledge and thank those speakers for their insightful views and ideas. I would also like to thank Catalyst for putting on such an important and good session today. Look, after listening to the different speakers today, what it reinforced to me is that the importance of the digital health sector here in Indonesia and the criticality of the skills development in this sector too. I mean, how far has the world come in terms of technology and digital advancement in the recent past? I mean, I don't recall ever having a telehealth consultation in Australia prior to 2020. But now you would barely find any clinics or doctors that don't offer some kind of digital health service. And this is a critical service for someone like me who is quite accident prone. Let me share a personal story with you. I was in Bali recently for about 2 weeks, and as a typical Australian, I hired a scooter for a couple of weeks. And as a typical Australian too, I actually crashed the scooter on the first day. But what was fortunate was that I was able to access a doctor digitally and virtually. And that doctor was able to diagnose me and provide a treatment plan on the spot. I followed his instructions. I iced the leg and I elevated my leg for about 24 hours. And miraculously, I was able to recover fully the next day. So for me, on a personal level, I was able to access the benefit of digital health. And it's made a difference to my holiday experience in Bali. Look, embarrassing scooter stories aside, I do want to highlight a few things today. First of all, Indonesia as a market for telehealth. And second of all, the Australian government initiatives on telehealth and how we could advance Indonesia's digital health sector. I was reading a report recently by Asia Link Business, and it noted that digital health revenues in Indonesia will rise from around $85 million a year in 2017 to close to $1 billion by 2023. That's a compound annual growth rate of 60%. With Indonesia's vast population of over 260 million people, spread over 17,000 islands, this country is a natural market for telehealth. But as we heard, it is important to recognize the challenges with the system, with the health sector here. As we heard from Professor Punawan, there is a significant impact from COVID-19 on the country, but it also presents an opportunity in terms of recovering stronger and recovering together, the theme of the Indonesia G20 presidency. We also heard from Dr. Nico talk about the challenges, the underspend, the underinvestment in healthcare, the high cost of treatment, and I think most importantly, the quality and quantity of health professionals in the country. And these thoughts are echoed by Park Hendra, who talked about the distribution of health professionals in the country. Jakarta. But what that means is that the regional and remote parts of Indonesia, those people are not having the same access to quality healthcare.
I think we might have temporarily lost Han. Okay, I think he's dropped off. So we will just continue on. Oh,
Am I back?
yes, you're back.
I don't know when I cut off. I'll tell you,
we were just talking about
right here,
Parkhendra, and then you went blank.
Let me pick up from Parkhendra's point about the distribution of medical professionals in the country. It's very important to note that because the professionals are based in Java and Jakarta, it does mean disparity in terms of service and access in other parts of the country. And I think these challenges can be addressed by a robust digital health sector. But as we know, training the health sector with digital skills is a significant undertaking. The upskilling and training of digital competencies will need to happen right across the workforce, from trainees to graduates to those people who have been in the industry for a very long time. And these people have varying levels of foundational digital knowledge. I mean, listening to Amy talk about Cochlear's global operations, it became very clear to me. It is very important for organisations to have a capable and competent workforce. From an Australian perspective, I'm sure most of you are aware that Australia has an international reputation for quality healthcare. And this is underpinned by the most valuable asset in any sector that interacts with human, its workers. Our health workforce is trained in high quality Australian universities, TAFEs, and registered training organisations. These education institutions would often engage with the health industry in developing competencies, training, curriculum, and assessment so that skills taught are most relevant to the needs of the sector. While that applies for the whole health sector, the same can be said of the digital health competencies too. And the Australian government recognised that digital health skills and training is more important than ever. In 2020, the Australian government released a national digital health skills and training plan to improve the capabilities and capacity of the workforce and further drive the digital transformation that needs to happen to meet community needs. The Australian education sector is quite proactive, and they've long recognised the growth of the digital health sector and the need for a capable workforce. The initiatives from the Australian government have simply put more fuel to the flame. There are many Australian education institutions that offer a range of digital health services, and these range from non-accredited short courses, micro-credentials, certificates, diplomas, all the way to master level education. I'm very pleased to hear from Kamani and Melissa about Holmes Glen's work in this space. And I think it's fair to say that other Australian education providers, just like Holmes Glen, can provide the capabilities and have the willingness to contribute to human capital development that is needed here in this country. We can assist with building a stronger and more effective digital health sector here that improves access, reduces cost, without compromising on the quality of healthcare. I would like to conclude by acknowledging the critical work that Catalyst is doing in facilitating the connection between Indonesian businesses and industry and Australian education providers. This program will support the human capital development in this country, which will ultimately drive the economic growth. I would also thank the other speakers again for sharing your insights, and I'm delighted to share the stage with you all. Thank you once again for having me here today. Terima kasih dan sampai jumpa lagi. Back to you, Clarice.
Thank you so much, Han. I'm really sorry to hear about your motorcycle accident, but we're glad to hear that you were able to access telemedical services very quickly that helped you in that tricky situation. So that actually brings us to the end of our session today. I want to thank you again for all attending, and thank you to Atensi for collaborating with Catalyst. It's been a great session to work with you on. If you're not familiar with Catalyst, we'd like to invite you to check out our website at IA-CEPA-catalyst.org and our social media channels at catalyst_IA. We'd love to hear from you. So if you do have any questions, please contact us. So from all of us at Catalyst, have a great day and terima kasih.